Hi guys, welcome back. We're gonna talk about non-alcoholic fatty liver disease. Now, what is this non-alcoholic fatty liver disease? The word itself tells non-alcoholic. That means whenever you take a lot of alcohol, it causes fat deposition in your liver. But in this case, when we say non-alcoholic fatty liver disease, this means you are accumulating fat in the liver, which is not due to an alcohol, right? This is a very dangerous phenomena going on, and upward trend has been seen from a couple of years, right? So you should not have fat in the liver. It is the same way. If you are having fat in the liver, it is going to cause fibrosis, then it is going to cause cirrhosis. Just imagine the normal cells inside the liver, that is hepatocytes, that are replaced by fibrosis, right? And fibrosis will not be the functional unit of liver. The liver works with number of millions amount of cells, that is hepatocytes. These are the structural unit of the liver, right? If you break down the liver, the most important structure of the liver is the hepatocytes. If you replace these hepatocytes with scarring, with fibrosis, right, with repeated insult, this will go into fibrosis, and slowly the liver will become smaller, and then the functioning of the liver will be impaired, right? First thing, why will be there will be fibrosis in the liver in the first place? One of the very important cause is fat. Deposition of fat affects the same way. If there is a cancer, same thing, there will be fibrosis, same thing, there is an insult to the liver, right? Whenever there is an insult, that liver cells will try to heal. Yes, it will be able to heal, but certain aspects, certain part will be going into fibrosis, right? Whenever you get a cut in your hand, or whenever you get a cut, that skin actually heals, but you see that surface is not as similar to the rest of the contour of your skin, right? So that is healing with a fibrosis. Whenever there is fibrosis, there will be pulling of the nearby surrounding, right? So what happens, the liver will slowly become smaller. Generally in cirrhosis patients who are having initial stages of cirrhosis, the liver will be bigger. If you palpate the liver, you will be able to palpate the liver, right? Whenever you press on the abdominal area, if you come and do palpation, you will be able to feel the liver. The edge of the liver can be able to be, you can be able to feel on the tip of your finger, right? The pulp of your finger, you'll be able to feel, or you'll be able to elicit tenderness in the patient, right? But in late stages of cirrhosis, because there is fibrosis going on, the liver will become smaller. At that circumstances, you will not be able to uh, palpate the liver, right? So we are talking about non-alcoholic fatty liver disease. As I told you, it is very dangerous nowadays going up. What is the cause of it? Very important is diabetes. If you are having diabetes, you will be having non-alcoholic fatty liver disease, right? If you are having diabetes, please make sure that you are controlling your blood sugar. Nowadays, the whole in the entire nation, India is considered as the capital of diabetes, right? Entire world, the number one cause of diabetes, the number one population see in diabetes in the world is India, right? So a lot of people are having diabetes. So the thing is changed nowadays, that how to prevent diabetes. To be very frank, it is not always very easy to prevent diabetes. If you're genetically immune, if you're genetically susceptible, you will be having diabetes. So the main option, the main target here is, we want to control the blood sugar, right? We want to control the blood sugar. Specifically, I'm talking about type 2 diabetes mellitus. If your parents are having, very high chance that you will also have, right? Whenever you're having a risk that you might be developing this disease, this risk factor is divided into two types: modifiable and non-modifiable. Now, what is the meaning of modifiable risk factor? This means what is in your hand, what are the things that you can do that can prevent the development of the disease. Example: do a lot of exercise, manage your stress, eat good food, have a proper sleep, maintain your body weight, right? So maintain your obesity, do not have obesity, have less saturated fat, eat healthy diet, avoid smoking, avoid alcohol. These are your modifiable risk factors, right? And non-modifiable risk factors means there are a lot of diseases which are very common in males, lot of diseases which are very common in females, right? There's a lot of diseases which are common in older age or younger age, infant age, neonatal age. So age you can't change, right? That is fixed. right? Another one very important is your genetic itself. If your genes are immune, or if your genes are structured, if your genes are designed in that way, you will definitely have that disease. A very, very high chance. And very important is your family history. You can't change your family history, right? Example, if I have a family history of diabetes mellitus, right, I am having a higher chance of developing diabetes mellitus, right? I can't change that risk factor. What I can change is this: I can change the modifiable risk factor. Now, what is this modifiable risk factor in my first place? I don't need to go have obesity, right? I should not have a lot and lot of sugary foods, right? Directly sugary foods will not give you diabetes. It will make you obese, give you overweight, then will put you in risk of developing diabetes mellitus. Third thing, I should not be taking unnecessary drugs like corticosteroids. The fourth thing, I should not be taking a lot of stress, right? I should be having a physically active lifestyle, no sedentary lifestyle, very less amount of stress, managing stress. These are the things I can do in order to reduce the chances of developing of diabetes mellitus, right? If I do this, I'm having a higher chance of not having diabetes mellitus in my aspect. Obviously, even if I have a family history, very high chance I'll have it. But what is in your hand, you should do it. What is in the family history, you can't change it. So always focus on the things that you can change. You are accountable. If you're not accountable for that thing, do not worry about that thing. Just let it go, right? Do whatever is in your hand, do it best and let it go. Whatever happens, happens, right? If I do all these precautions, I'm having the least chance of developing diabetes mellitus. But again, if I'm having a family history, definitely I'm going to have more higher chances of developing diabetes mellitus comparing to a person who is not having a family history. Okay, so do not get disheartened, or do not get stressed out that your family members are having this disease or that this kind of disease. You can't change it. That is inherent. It is family history. So what? Just focus on the fact that what you can change. That is the modifiable risk factors, right? So we were talking about non-alcoholic fatty liver disease. I went deliberately out of the topic just to give you an idea of this. So how do you prevent non-alcoholic fatty liver disease? Very, very important is that obviously you don't want to have diabetes mellitus. If you have, do regular checkup, maintain your blood sugar level. Second thing is that do not take unnecessary medication, especially painkillers and especially the paracetamol, right? Please remember, you're not supposed to take paracetamol unnecessary. You just have a headache and you take 2 pills of paracetamol. You just have a little bit joint pain, paracetamol. You're having a little bit of fever, take paracetamol. Please try to understand, the least amount of drugs that you take is best for your body. But of course, anytime you're taking a medication, you have to see the benefits and the risk ratio. All the medication, all the medicines that you're going to take will be having risk and will be having benefits. If the benefits of taking the medication is higher, definitely you should take the medication. If the risk is more, you are not going to take the medication. Is that right? Okay. Very important is paracetamol. If you're taking a lot of paracetamol, a lot of saturated fat, the fat that is coming from oil, vegetable oil, very high chance diabetes mellitus, and you're not doing your liver function test, and you're not also doing your ultrasonography of your liver. It's quite not very expensive to do an ultrasonography. It's around 1,000 rupees. You do an ultrasonography of your liver, of your abdomen. Either you can do of your entire abdomen. It will look for any small stones. It will see your kidneys, right, and it will see your prostate. It will see your liver. It will see the blood vessels are perfectly fine or not. The gallbladder is perfectly fine or not. These things will not show you symptoms unless you are in a very, very critical stage. Liver and kidneys are very, very silent organs. It will not show you any symptoms of damage. You may just go and check it out, and go and talk to any of the doctor and ask what are the signs of liver damage and what are the signs of kidney damage. You definitely have signs. You definitely have symptoms. But these things will be occurring only and only if you damage your liver to a very, very, very great extent. Just to give you an idea, again, we are having 2 kidneys. Imagine one of my kidneys 100% damaged. I will not have any symptoms. The remaining 1 kidney that I have is 50% damaged. I will not have any symptoms. It goes and damage up to 75%. I will have no symptoms. The moment it reaches around 75% or more, then and only I'm going to have the symptoms. So that is the reason you have to understand. I'm not having any symptoms of kidney damage. Why should I go and get my kidneys checked? Because you never know. One kidney might be absolutely damaged. And what is the most common cause of kidney damage is very, very important, is your uncontrolled diabetes mellitus and uncontrolled hypertension. Very, very important, right? I did made a video about how can you keep your kidneys safe, and what are the risk factors of developing kidney disease, what are the causes of kidney disease, right? So this was a small video. I do understand this video was haphazard. I talked something about non-alcoholic fatty liver disease, I talked something about kidneys, I talked something about the liver, but I just want you to understand and share the concept of risk factors which are modifiable, which are non-modifiable, and do not think that you do not have disease. Whatever you see from outside, yes, a person might be very very fit, he might be able to do a very good amount of bench press or going to the gym, or he's able to run a long distance or sprinting, very muscular body, he might look very very good, but inside you never know what is the functioning of his liver, what is the functioning of his heart, what is the functioning of his kidney, how is his blood pressure level, what is the blood sugar level of the patient, what is the lipid profile of the patient, what is the complete blood count of the patient, is the patient having hemoglobin perfectly or not, what is the thyroid function test of the patient. You cannot say this just by looking at the patient. Of course you will have the symptoms, but as I told you, these are very very hidden kind of things that are supposed to be found out by incidental finding. That means I just do a random medical checkup and then I find out. That is the very very important, that you should be doing your regular medical checkup at least once a year, at least once a year, if you are not having any medical disorder, right? If you're having blood sugar level, if you have a known case of diabetes mellitus, at least every 3 months go and check your blood sugar level. Even if you're taking a medication, or if you're having high blood pressure problem, at least in every 3 months go and get your blood pressure level checked. These are two very very important. And also go and check your go and have an appointment with your ophthalmologist, right? He needs to see your retina. Very 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 important. Diabetes as well as in hypertension, very very important, right? And you also have to see for your urine output, your kidney function and liver function. These are very important basic tests that you should be doing on a regular basis, all the time, that you should be doing. It is not going to cost you a lot of money, at least once a year, maybe 3 or 4,000. 4,000 is nothing in comparing to your body's own asset, right? What are the tests that you should regularly do, even if you are not having any certain kind of medication disorders, medical disorders? Very very important is complete blood count. Very cheap, very easy to do. Second thing is lipid profile. Very very important. How much amount of fats, how much amount of HDL, how much amount of LDL, how much amount of cholesterol, how much amount of VLDL, bad cholesterol, good cholesterol are there in your body, right? The next test you want to do is known as something known as TSH, thyroid stimulating hormone, and T3 and T4. This is important for your thyroid. The next thing you should be doing is the LFT, liver function test. Very very important. The next test you are going to do is kidney function test, which is serum creatinine mostly. Very very important. And go and get your blood sugar level checked. Very very important, right? You can do a random blood sugar level or HbA1c, anyone you can do. Okay, once you do it, you should go and get your blood pressure level checked. Very very important. Then if you want, this is optional, but if you want, you can go and get your ECG checked, right? I'm not saying it's mandatory. If you want, you can go and check. The next thing that you always want to do is that if you're around a bit kind of adult kind of age, go and check your vitamin D profile. And if you're around male and around 40 years or so, go and check your prostate specific antigen. Female around that age, always do a mammography. And anytime you become sexually active, any age, 20 years, 15 years, 12 years, 20 years, 25 years, anytime you become sexually active, you have to do your pap smear, because you will be having a chance of developing of cervical cancer. This is very 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 important. And females around 40, 45 plus, 50 plus, you should be starting your mammography. And please do not throw off the mammography films that you have. This has to be compared from the previous to new one, right? And also maintain your blood your this thing your body weight. And also very very important, go and get your eyes checked at least once a year. What are you going to check in the eye? Long distance, short distance, and very very important, intraocular pressure. If you're having glaucoma, you will not know that you're having glaucoma. All right, so that was a small video about this, and I'll see you in the next video. Thank you for watching.